Hi everyone, I'm Yu, a registered nurse, and today we're talking about wounds. In the aged care environment, a simple skin tear or small pressure injury can become life-threatening if infection sets in. Most family carers miss the early critical signs. I'm going to give you the clinical markers we use in the hospital setting to catch it early. The harsh truth. A trip to the hospital for sepsis often starts with a preventable home infection. What is the number one sign you must never ignore? Spreading redness or lymphangitis? It means the infection is leaving the local site. Clinical signs of infection. The 5-point check ***. We use something called the REEDA principle. I'm simplifying it to the 5 must-know signs for home carers. 1. Worsening pain, not just discomfort, but a throbbing pain that paracetamol doesn't touch. 2. Spreading redness and swelling. The redness should not spread beyond a centimeter from the wound edge. If it's creeping out, that's a red flag. 3. Pus, purulent discharge. If the discharge is thick, yellow, green, or smells bad, that's pus. Clear or light straw-colored fluid is often normal healing exudate. Pus is a call to action. 4. Local heat. The area immediately around the wound feels significantly warmer than the surrounding skin. 5. Systemic symptoms. If the person has a fever, chills, or feels generally unwell, the infection is no longer local. This requires urgent medical help. Choosing the right dressing, exudate control, ***. A wound needs balance, not too wet, not too dry. This is where your dressing choice comes in. Wound is wet, high exudate. You need an absorbent dressing like a foam dressing or Alginate. These suck up the excess fluid, preventing maceration skin breakdown from moisture. Wound is dry, low exudate. You need a moisturizing dressing like a hydrogel. This rehydrates the tissue to help the cells move and heal. Your home care RN will assess the exudate level and prescribe the correct dressing for the stage of healing. Step-by-step technique. The aseptic principle ***, for any serious wound. We use the aseptic non-touch technique, ANTT. For carers, this means 1. Clean hands, clean field. Always wash your hands and use gloves and change them if they become soiled during the procedure. 2. Only sterile solution. Only clean the wound with the solution your doctor or RN prescribed, usually saline, not harsh antiseptics. 3. 1 swipe, toss. Clean gently, moving from the cleanest part the wound to the dirtiest part the surrounding skin, using a fresh gauze for every wipe. Never wipe back and forth. When to escalate to the registered nurse, call your care manager's RN line if you see pus, spreading redness, or new pain. Call 000 or your GP if there is a fever, sudden severe pain, or systemic illness. Do not delay. Wound infections are emergencies. Wound care is a team effort. You, the family, are my eyes on the ground. Be vigilant, know the red flags, and demand a clinical review if you're concerned. The shift is digital. This is not your grandma's aged care. For too long, the default vision of aged care was a large, sterile facility, but the future, driven by technology and consumer demand, is overwhelmingly focused on aging in place. As a care professional, I've seen technology transform lives. Today, we're diving into the 3 pieces of tech that are making this possible, and more importantly, how you can actually get your home care package or NDIS funding to cover them. Segment 1, Tech for Safety, the registered nurse perspective. The number one goal of care is safety, and tech is making it seamless. I'm talking about smart wearables and AI fall detection. These devices monitor heart rate, movement, and even sleep quality. If a fall occurs, it alerts a caregiver immediately. Care professionals. This is not replacing you. It's empowering you. It gives you data to back up your clinical judgment. For families, this is often fundable under your HCP as assistive technology. Remember to justify it with a safety plan. Segment 2. Tech for connection. Beating isolation. Isolation is a silent killer in the aged care community. But technology is fighting back. We're seeing more use of companion robots for fun and task reminders and smart home hubs like Google Home or Alexa used for social connection. Yes, you can sometimes get an iPad funded if it's demonstrably used to access telehealth, connect with family, or reduce cognitive decline. The key is purpose. It's not for Netflix. It's for social and cognitive engagement as prescribed in the care plan. The future of care is smart, safe, and personal. For the seniors and families watching, don't be afraid to ask your provider about the latest tech. For my care entrepreneurs, this is where your business needs to innovate. If you're ready to integrate these services and offer a truly modern care solution, the Care Compass teaches you exactly how to build a tech-forward, compliant service model. Like and subscribe to stay on the cutting edge of Australian aged care.